Thank you very much, Cal. 6:18 now. And if you're struggling to get out of bed this morning with aches and pains in your joints, I feel your pain. But what can you do to alleviate some of that soreness? This morning on Ask a Specialist, we'll talk about some of the treatment options available with Dr. Paul Morton, hip and knee reconstruction orthopedic surgeon at the Queens Medical Center, West Oahu. Doctor, thank you so much for joining us this morning.
Good morning.
First off, what is osteoarthritis?
So osteoarthritis is really the beginnings of when your joint starts to wear down and your cartilage starts to break away. And so the important thing is on x-rays, you'll start to see breakdown of the joint. Bone-on-bone arthritis is typically what people like to talk about. You know, people will often say that their first thing when you wake up in the morning, you have morning pains that start to get better as you get going. And pain really starts to, you know, bring you down and stop you from getting to your normal activity.
So how can you make it better without surgery?
So without surgery, I think the keys to treatments are, you know, trying to keep your weight low. You know, there's a lot of over-the-counter types of pain medications like non-steroidal anti-inflammatory medications, like Tylenol, naproxen, ibuprofen, other things like Tylenol work very well. Physical therapy, exercise are great ways that we can help you with getting your pain down lower. And injections with steroid medications will help reduce the inflammation.
What about icy hot? Because that's my go-to.
Icy hot, if it works for you, I wouldn't stop you.
All right. So, doctor, what are the latest developments in surgical treatments for osteoarthritis? So,
you know, with total hips and total knees are still the standard for the vast majority of patients with arthritis that fail conservative treatments. But some of the things that have changed over the last few years are the advance of some of the plastic components within these total hips and total knees that we use. These plastic components do a much better job at lasting longer than they used to. Some of the things that we do now, we think about doing partial knees, which you know, you don't require resurfacing the whole joint, as well as performing total hips through the anterior approach, which gets patients up faster than they used to.
And is this the hip right over here?
This is the hip. I think one of the more exciting things about these hips is that we're now using ceramic as part of the hip replacements. And these ceramic components will allow for the hip to last a lot longer than it used to. And some of the other things that we're doing now is we're starting to use robotics within the doing total joints. And robotic surgery gives us a lot better of the ability to position the implants and hopefully get patients to have longer lasting implants.
What's the downtime on having hip replacement surgery or reconstructive knee surgery?
So it's a little bit different for hip and knee. So hip replacements, I find patients, both of them, we're getting them out of the hospital oftentimes the next day and sometimes the same day. You know, some of the more complicated patients might require a couple of days, but I think the vast majority are getting out pretty quickly. Downtime, I think, is roughly about, you know, somewhere between 6 weeks and 3 months. People are starting to feel like they're pretty satisfied that they had, you know, their joint replacement. And, you know, it takes up to 1 year to 2 years to get the full benefit.
And once you get a knee replacement or hip replacement, you're pretty much good to go for the rest of your life? Hopefully?
Hopefully, but not always.
All right, to learn more about emerging technologies and joint replacement, you can join Dr. Paul Morton for the Queen's Free Speaking of Health lecture. That's happening this Thursday, September 19th from 6 to 7 p.m. at the Queens Medical Center, West Oahu. To register, you can call 691-7117, or you can go to queens.org and click on Classes and Events. Dr. Morton, thank you so much for joining us this morning.
Thank you.
All right, coming up next, a flower that smells so bad it's become a popular attraction. We'll have an update on the corpse flower and how much